Welcome back to Feeling Good Feels Good. I am your host, Dr. Tripp. This is the podcast where we make feeling good feel simple. We do this by shining light on the real and practical ways that help people feel good and break down the actual cause of why people might feel bad in a clear and simple way. We do this by creating interactive mysteries that lead us to the real benefits and everyday items and the real causes of why people feel bad. Today's patient is a fictional character inspired by real clinical experience. Results vary, and nothing in this episode is medical advice. So I want you to meet Penelope Frank, 34 years old, chef in Philadelphia. And when she walked into my office, she walked in the way a lot of people walk in when they've been hurting for a long time and have gotten very good at hiding it. Not a wince at every step, something subtler than that. A careful, calculated way of moving that told me that her body had been quietly negotiating with pain versus movement for so long that negotiation had become invisible, even to her. She sat down and told me her right hip was killing her. Her hip and her groin, all on the right side. It was getting worse as the day goes on. By the end of a dinner service, she can barely walk to the train. And she's a chef, so the day is long. The floor is hard, and there's no sitting down. She's been dealing with this for about 2 years. She's seen her primary care doctor. She's gotten her hip looked at. She's taken Advil more times than she can count. And the Advil, she told me, helps her hip and her lower back. But then, when the Advil kicks in, her low back and hip quiet down, but her feet start to hurt. She can feel her feet more. She didn't really know what to make of that, but it was my first clue. So I asked her about her day. She told me she takes the train to work, and she loves the train, actually. It feels like the one part of her day when she feels genuinely relaxed, where the pain backs off enough that she can breathe. Driving, on the other hand, is worse. She sold her car 2 years ago, partly because driving was making everything worse. Traffic was getting worse, and she was spending more and more time in the car. There was something about pressing on the gas pedal, that motion, that would light up her entire right side. I asked her about sleep. She sleeps flat on her back, she doesn't move that much, and she mentioned that she hates the feeling of her blanket pushing her feet down. And when that happens for too long, getting up in the morning becomes really brutal. The first 20 minutes out of bed are the worst part of her day until the end of the day. Every morning, she dreads that first step. I asked her where she worked. She said, Colin and Jenny's. I asked her how long she'd been a chef. About 8 years, she said. When she first started, she started in a different kitchen. The floors were much harder, and being a new chef, she wore shoes that were way too small for the job. She said she bought the size that she always wore and didn't realize until months later that her feet were swelling during her shifts and that she'd be cramming them into shoes that didn't fit her. And she'd been doing this for almost 2 years. She switched kitchens, got better shoes, but something never quite felt like it went back to normal. She also mentioned that her coworker, Terry, had the same hip problem. Terry found that stretching her hamstrings out made her feel better. She doesn't know why, she just knows that it helps. So I want you to start paying attention. I've already laid down a lot of clues. Think about her name, her restaurant, her coworker's name, the train, the gas pedal, the blanket on her feet, the Advil working for some things and not working for others, the shoes. The clues are all starting to build up. And we're going to get into it a lot more. So Penelope sits down across from me and I start observing before I ask a single question. The first thing I notice is how she moved getting into the chair. Slightly bent forward, but her knees were bent quite a bit. Her knees were flexed so much that her feet were under the chair. It was second nature to her. She didn't try to sit this way, but her knees were folded and her hips were folded. You could tell that her right hip was slightly elevated to her left. Not dramatically, but enough so that it was noticeable to a trained chiropractor. And when I asked her to stand up and walk across the room, things started to clear up even more. She pushed off her left side way more than she pushed off her right. She was propelling herself forward way more off her left leg than her right. Her right side was doing less work with every step and every stride. I asked her more about the Advil, because to me this detail was important. She said when she takes Advil, the hip and the lower back feel better. Almost normal, slightly achy, but way better. But then she notices her foot. It's like when she takes Advil, her back and her hip stop talking, but her heel starts talking. It doesn't feel injured necessarily, just present. like it's been trying to get her attention, but the hip pain was too loud to hear it. Now that was some useful information. So let's talk about what I noticed when I examined her. The first thing I looked at were her ankle and her feet range of motion, and they moved okay, but the right was definitely more restricted than the left, particularly when she tried to lift her toes up away from the floor. Years of kitchen work, constant standing, heel elevated kitchen clogs, never stretching. This had chronically shortened her calf muscles. And here's why that matters. The calf attaches to the Achilles tendon into the heel bone. If the calf is tight, it's constantly pulling on the heel, and everything that attaches to the heel is getting pulled with it. Second, I did a test called the windlass test. Simple. I had Penelope seated, and I basically just moved her big toe. I bent it toward her shin, and the moment I did, she said, "Yep, I feel that sometimes," and she pointed right to her heel. She came in with a hip problem, and a lot of what I was doing was already reproducing pain by moving her toes and the bottom of her feet. I asked her if she'd ever had heel pain, and she said, not really, but maybe sometimes in the morning, but nothing like her hip. I pressed on her heel. She winced. Not dramatically, but she winced. She said, I didn't know that was sore. Third, I asked her to stand on one foot and push up onto her toes. And when she did the right side, she got partway up and compensated immediately. Her hip hiked, her torso dropped, and she couldn't complete a basic calf raise on the right side. So I checked her hip. After the calf raise, I asked her to continue to stand on one foot and watch what happened to the hips. In chiropractors, we do this test. We have the patient stand on one foot and we watch what happens to their opposite side hip. It tells us whether one hip is weak, tight, or just not functioning properly in some way. And on the left side, her hip dropped because the right foot's push-off had been altering her loading pattern for years. Maybe it's starting to look like a downstream effect and not the source of all of her problems. And then I did something she didn't expect. I checked her feet and her hands' temperature. I asked her about cold. Her feet definitely felt cold and her hands felt cold too. Not dramatically, but the limbs were definitely colder than the core of the body. And this was significant. She said, "Yeah, I always wear socks. Even in the summer, my feet get cold fast." Now, a traditional Chinese medicine practitioner might start thinking about the kidneys. The kidney meridian. The kidney meridian runs through the sole of the foot. They look at this as the lowest point in the kidney channel and the point where the body connects to the earth. As a chiropractor, I look at this as where the foundation of movement begins, in the feet, when they touch the ground. In traditional Chinese medicine, the kidney governs the bones and the connective tissue. Kidney deficiencies might present as cold extremities, poor circulation to the lower body, particularly the lower body limbs, aka the feet, degenerative conditions that build up slow and are slow to heal, and pain that is worse in the cold. Penelope's feet were cold, and to me, there were some signs that her tissues were degenerating. She did mention that her symptoms get worse in the cold weather, and she even wears socks in the summer. It's interesting because my chiropractic diagnosis matches some of these patterns described in traditional Chinese medicine. They described degeneration, and in chiropractic, we're analyzing degeneration of specific tissue. So Penelope Frank, let's start with the initials. Think about the initials. Think about where the exam led. Do you have it yet? I bet you're close. I bet you're in the right body part or the right area. PF, plantar fasciitis. The diagnosis was her name the entire time. Now let's go back to the restaurant she works at. Colin and Jenny's. Collagen, the primary structural protein of plantar fascia, the tissue that is degenerating in her foot. She has been working every day in a restaurant named after the molecule that is failing her. Colin and Jenny's is wearing out, and it's wearing out her collagen. Terry, her coworker, who had the same problem, who feels better after she stretches her hamstrings. Terry, tearing, the micro tears in the collagen. Micro tears in the collagen fibers are what lead to plantar fasciitis. And Terry, stretching her hamstrings, is her body finding the right answer for the wrong reason. She's releasing tension in her posterior chain, the continuous fascia that runs along the back of the body, from the bottom of the foot through the entire posterior chain to the back of the skull. Terry found what worked for her instinctively. She just didn't know why. She was stretching part of her posterior chain. Now, this one might have been a little trickier. Maybe some of the chiropractors listening figured this one out. The train. Penelope loves the train because the train is the only time in her day when she was completely unloaded, seated, passive, no weight bearing, no posterior chain tension, no gas pedal. The anatomy train. The myofascial system connecting her foot to her hip to her spine finally gets to rest. She is at rest on the train when her anatomy train is at rest. Pressing down on the gas requires plantar flexion, flexing the foot down using the calf, pointing the foot down under resistance. This is the exact movement that loads the degenerated plantar fascia and the tight Achilles complex under tension. She sold her car 2 years ago without knowing that it was her foot driving the decision. Now think about the blanket and think about her sleep. This is actually more common than most people realize. Sleeping flat on her back with a heavy blanket pressing her toes down, pressing her down into that same plantar flexion movement like when she's pressing on the gas pedal. She's been putting herself into the worst possible position for 8 hours every night. The plantar fascia is contracted the whole night. The overnight contracture shortens the tissue, lays down micro adhesions, and then that first step in the morning tears them. She mentioned the first steps in the morning being the worst part and feeling pinching in her feet. Now, let's think about the Advil. This one might be the toughest clue, but it might be the easiest for the best of practitioners out there. The Advil quiets the hip and the lower back, the compensation pattern. This is likely where she's inflamed, and when the compensation pain goes down, the source gets louder. The drug actually unmasked the diagnosis. The foot was always the primary driver, but the hip was the translation. And plantar fasciitis is incorrectly named itis. It is not necessarily a condition of inflammation. So when she gets rid of the inflammation, she actually feels it more. And finally, the shoes. 5 years ago, a kitchen with hard floors and shoes that were too small, compressed toes, restricted windlass mechanism, her muscles were unable to function, and the plantar fascia was stressed out for 2 years straight working that job. She fixed the shoes, she changed the kitchens, but the damage was already built into the tissue. The crime scene might have been cleaned up years ago, but the body still remembered. So Penelope came in with a hip problem, but she really has a foot problem, and every detail of her life has been pointing at her foot the entire time. She just never looked down.